When someone's in danger, of course, people rush to help. But even if these good Samaritans mean well and are being very brave and selfless, they can end up putting the victim in even more danger if they don't know how to properly administer first aid. That's why it's crucial to avoid these 10 common and very dangerous mistakes and learn what you should do and head back during a nosebleed. Nosebleeds can be common since there's so many blood vessels in the nose that are highly sensitive to things like dry air and, well, fingers. There are some situations where nosebleeds are caused by an underlying health issue, in which case you'd need to seek advice from a medical professional. No matter what the reason, we've all been told to tilt our head back whenever we have a nosebleed. But it's high time to ditch this old habit. Tilting your head back can make the blood travel from your nose to your throat, which means you could find yourself choking on or swallowing blood. The best thing to do instead is to apply steady pressure to the bridge of your nose for at least 20 minutes. You'll have to breathe through your mouth this whole time, but you'll safely stop the bleeding. Number 9. Forcing a fainted person to sit up. When someone faints, our immediate course of action is to try to sit them up, especially when shaking them doesn't seem to be helping. Instead of all that, always start by checking their breathing and pulse. If that's all good, leave them on the ground, but raise their legs about 12 inches off the floor. Loosen any restrictive clothing as well. Once they regain consciousness, don't... Number 2, not knowing what you're doing. Again, good Samaritans mean well when it comes to helping someone in an emergency situation. But if you don't know how to, for instance, administer CPR or the Heimlich maneuver correctly, you can end up doing more harm than good. For example, someone might try to give CPR and forget that you have to tilt the victim's head back to keep the airway open. That can be a very dangerous blunder. That's why the first line of action in all serious first aid situations is to call for help and let a professional guide you through what you need to do. Number 1. Using a tourniquet for a bleeding wound. Yes, tourniquets can stop a person from bleeding, but it's not a fix-all solution for any type of wound. If someone has a deep wound in their arm or leg, applying a tourniquet can stop the blood flow to the entire limb, which can actually starve the tissues of oxygen and possibly lead to amputation. Using a tourniquet should never be the first choice. You know by now that your first course of action should be to call for an ambulance. While they're on their way, apply downward pressure with your hands onto a major wound that's bleeding out. If you have sterile gauze, then use it so that you don't transfer bacteria from your hands to the wound. This method can even stop bleeding from a large vein or artery. Once the bleeding has stopped, wrap the wound securely with gauze. Only use a tourniquet if, after all this, there's still uncontrolled bleeding. But by this time, the paramedics should be close. Have you ever had to administer first aid to someone? Let us know in the comments.